Good evening, trustees. My name is Andrew Helms. I'm the Chief Financial Officer for Teachers Health Trust. With me today is Tom Zumtobel, our Chief Executive Officer. Tom joined Teachers Health Trust in 2021. Also with me today is Peggy Melton, our Board Chair. Peggy is a retired CCSD educator who joined our board in 2022. Today I'll be presenting the audit results for the fiscal year ending June 30th, 2025. I'll also provide a general overview regarding the state of the trust. The first question I want to address is what makes the THT-CCSD relationship unique?
We need to move the slide back.
Oh, thank you. Thanks, Tom. At Teachers Health Trust, we look at ourselves as partners with the school district. In other words, we're not just another vendor. Teachers Health Trust was founded in 1983 through collaboration between CCSD and CCA to provide health benefits for our educators. Transparency isn't just one of our core philosophies, it's actually an integral part of the CCSD-CCA negotiated agreement. We provide monthly financial statements and an independent annual audit to the school district, in addition to several other key stakeholder reports. Each year, we also provide a State of the Trust presentation, which includes the audit findings, to the CCSD Board of Trustees. Teachers Health Trust is governed by a 7-member board of trustees consisting of active and retired educators and community experts. One of the unique differences between Teachers Health Trust versus for-profit insurers is our fiduciary responsibility. Our trustees and our executive leadership are all fiduciaries of the health plan. This means that we are all personally obligated to act in the best interest of our members. Additionally, all THT staff and executives utilize the same health benefits as our educators, which ensures benefit decisions are made with direct personal accountability. The June 30th, 2025 fiscal year audit was conducted by Holdsworth, Russo & Company. They issued an unqualified audit opinion, otherwise known as a clean report. This means that there are no material issues or findings. Most notably, the audit report indicates that previous substantial concerns about THT's ability to continue no longer apply. This is a significant financial achievement and reflects our commitment to continuous operational improvement. Additionally, THT is now completely financially solvent, meaning we are debt-free and have enough assets to cover our benefit obligations. We use a handful of key performance indicators to consistently measure our performance. One of the main KPIs, the quick ratio, evaluates how well our liquid assets, such as cash, marketable securities, investments, and near-term receivables, such as pharmacy rebates, can cover financial obligations. It's a realistic but simple indicator of overall financial health. It cuts through the accounting noise. It means right now, without selling anything, can we pay our bills? A quick ratio below 1.0 is a warning zone for liquidity. It means there are significant financial risks. A quick ratio of 1.0 or higher is healthy for most self-funded nonprofit benefit plans. It reflects true cash availability. In the chart on the right, we show THT's quick ratio over the previous 10 years. The red zone represents high risk, meaning we are either over or underfunded. Yellow is cautionary, and the green zone shows an ideal quick ratio range. From 2016 to 2020, the quick ratio was well below 0, meaning THT was in financial jeopardy. Beginning in early 2022, under new executive leadership, the quick ratio started to improve year over year and remains on a positive trajectory. As of the most recent June 30th, 2025 audit report, our quick ratio was around 1.3, and that means for every $1 in current liabilities, we have $1.30 in liquid assets. This vast improvement in the quick ratio demonstrates a much healthier, fiscally sound balance sheet than in years past. Between fiscal year 2024 and fiscal year 2025, medical expenses increased by $8.3 million, or 4.5%. This increase closely aligns with anticipated inflation, as well as the increase in employer contributions from the school district. Even though we consistently and proactively manage our cost, healthcare inflation is significantly higher than regular economic inflation. We performed well. However, with medical claims, you just never know what's waiting around the corner. Our administrative costs, which include TPA fees, legal fees, and office overhead, this decreased by $1.6 million, or 12.5%. If you recall, during last year's presentation, I mentioned we put new measures in place to help control our administrative costs. This reduction in expense demonstrates our culture focused on continuous improvement. In other words, we're always striving to do better. As fiduciaries, we have a personal responsibility to ensure that we are investing in high-quality programs that are guaranteed to improve the health benefits and enrich our members' lives, and this is no easy task. The industry standard for administrative expense is around 15%. So in other words, 15% of revenue is allocated to non-medical expense, such as salaries and TPA fees. For most health plans, 15% is acceptable. At Teachers Health Trust, however, we obsess over quality and accountability. Due to our team's hard work and dedication, we were able to achieve a 4.7% administrative cost ratio in fiscal year 2025. This means that only 4.7% of revenue was used for overhead. This resulted in approximately $25 million that we were able to reinvest back into additional benefits for teachers. Due to these savings, we've been able to substantially improve the benefit design for the educator's health plan. For the past 3 years, there's been no increase to active teacher premiums for THT health plans. As of January 1st, 2026, certain family premiums were reduced by $1,000 to $3,000 per year. These new tiers are designed to alleviate financial strain for certain educators based on their number of dependents. Also, as of January 1st, we launched the newly enhanced Advantage Plan, which now provides 100% coverage for health investment providers. All members now have priority access to the newly designed health investment program at no additional cost. Under this unique benefit enhancement, both Signature and Advantage Plan members can see high-quality local providers with $0 copays and expedited appointment availability. Throughout 2025, we identified and added 39 additional high-quality care providers to the Health Investment Network. Also, since the last presentation, we listened to your concerns, and we added several providers to the network who are located in the northeast part of the valley. To date, by utilizing the Health Investment Provider Network, members have saved approximately $556,000 with 29,000 unique appointments made. I'd also like to point out that these aren't the only providers our members can use. Teachers Health Trust members have access to the Sierra Healthcare Options, or SHOW network. This is the largest provider network in the Las Vegas area, with the same providers utilized by Nevada's largest employers, such as MGM, Caesars Entertainment, Clark County, and the state of Nevada. And then we track our in-network provider counts on a monthly basis. So, for example, as of January 31st, we had 9,890 medical providers and 2,743 behavioral health providers within the network. Over the past year, we've made significant improvements to our diabetes management program. If members visit one of the 6 Las Vegas endocrinology locations within the Health Investment Network, they can expect to have all copay, coinsurance, and deductible amounts waived. For most insulins, member out-of-pocket costs are no more than $20 per month. Meanwhile, syringes, lancets, and test strips are fully covered at $0. Benefits, our support team is here to assist you every step of the way. No matter who answers the phone, you'll receive the same professional, consistent support. Just to reiterate, getting members the care they need is our highest priority. Throughout 2025, we continue to establish credibility throughout the community with several member-focused initiatives. We revived the free health fair for all members, bringing preventative services directly to educators and their families. We utilized several media outlets to promote our benefit offerings, including free on-site primary care and mammograms at select schools, and coverage for new blood tests aimed at preventing preterm births. We also had a courageous member share his journey and testimonial with Fox 5 News after successfully losing over 80 pounds through bariatric surgery. And just for reference, we've linked these articles in your PDF, but we're more than happy to send you any of these pieces directly. While we've had great success in recent years, our work is never done. In 2026, we're working hard to make your health benefits even richer. We're evaluating alternatives to improve networks and reduce friction for educators while preserving access to quality health care. This is a community effort, and it requires self-funded plans as fiduciaries to come together and leverage against the for-profit insurers who only wish to make more money for their shareholders. And we won't be satisfied until this market changes. We're also exploring ways to use modern tools to enhance self-service options, which includes finding benefit information or resolving common issues faster. We'll continue to control costs in all areas and identify ways to improve premium affordability without sacrificing access or outcomes. This concludes my presentation of the fiscal year 2025 audit results and the state of the trust. At this time, I can respond to any questions or comments. Thank you.
Thank you so much. I'll open it up to the trustees for discussion. Trustee Barone.
Thank you very much, Madam President. Well, as a recently retired educator and the user of one of these, having Teachers Health Trust being my provider, I'll tell you, although a few years ago it was embarrassing because I actually had a couple of my providers who are asking me, hey, I got these bills here, are they gonna pay? And I remember being on the phone for a long time. I can't tell you how enthusiastic I am about the outlook here, the 180 turnaround, and I really want to thank your team. The reason why this is really important is because here you are as an educator. Again, I recall staying up till 1, 2 o'clock in the morning, grading papers. And then when I had a chance to look at the bills, right, I saw things come up. The last thing we want for our employees is to have a doubt about being able to provide for their own families, okay? And what this does is this, I think this works really, now granted, nothing's perfect, but this is, again, a huge step in the right direction. I'm really happy to hear this. And I think this brings, quite frankly, a lot of faith back to our employees. And again, I really applaud all the work that you've been doing. Again, you're running lean, you're running mean, and, you know, doing things in a very business-like, you know, fashion there. I'm really heightened. I'm really inspired. I think I'm gonna have to try harder on everything that I do because I see that everyone else is doing a good job. So I think I'll have to work harder as well.